Live from Washington, this is BBC News. As the Supreme Court curtails LGBTQ protections in a landmark case, BBC News takes a closer look at restrictions and challenges facing the transgender community in the U.S. And bans on trans athletes competing in gender-specific sports are on the rise. We speak to a lawmaker who proposed one of those bills. I'm Sumi Somaskanda. Thank you for joining us. It is the end of Pride Month here in the United States, which comes at a challenging time for many members of the LGBTQ community, as restrictions on transgender healthcare and other LGBTQ rights take center stage in many states. Tonight, we're taking a look at some of the most pressing issues facing trans Americans from different perspectives to bring you insight into some of the country's most complex issues. Now, according to the Human Rights Campaign, which supports and advocates for LGBTQ issues, there have been a record number of bills against the trans community. As of May this year, more than 220 bills targeting transgender and non-binary people have been introduced in state legislatures. 15 laws banning gender-affirming care for transgender youth have been enacted. 45 bills banning transgender students from playing school sports were introduced. And 30 bathroom bills that target transgender people were filed this year. The Human Rights Campaign also reports 20 states have enacted bans on gender-affirming care for minors. Almost all of those states have Republican-led legislatures, and only 2 have Democratic governors, Arizona and Kentucky. Now, in both of those states, Governors Katie Hobbs and Andy Beshear have attempted to counter trans healthcare bans by signing executive orders that carve out protections for minors within their states. In response to these bans, liberal states like California and New York have passed shield laws protecting access to transgender health care. But how many adults and youth identify as transgender in the U.S.? Well, according to the UCLA School of Law Williams Institute, a research center on sexual orientation and gender identity law, there are about 1.3 million adults in the United States who identify as transgender. That is about 0.5% of the entire adult population. But about 1.4% of youth aged 13 to 17 identify as transgender. That is the largest number of all of the age groups. For more on this, I spoke to U.S. Navy Admiral Rachel Levine, about transgender rights. She is the Assistant Secretary for Health of the U.S. Department of Health and Human Services and the highest-ranking openly transgender U.S. government official. Admiral, thank you very much for joining us in our studios today. You were confirmed by the U.S. Senate in 2021. Since then, how have you worked with the U.S. Department of Health and Human Services to protect and also further LGBTQI+ rights?
Well, one of the absolute priorities for the Department of Health and Human Services under our Secretary Becerra, is health equity. And that includes health equity for many communities. Communities of color in the United States, but also for the LGBTQI+ community. And so we have been working on many different fronts for health equity and to address health disparities for our community.
So what are some of those disparities and how have you tackled that?
Well, there are a number of different health disparities that we see in the LGBTQI+ community. Challenges in terms of cancer screening for lesbian women. Issues in terms of potential cancers for gay and bisexual men and other men who have sex with men. Of course, ending the HIV epidemic is critical. One of the things we've been doing now is trying to respond to many of the attacks that our community has faced in a number of states across the country.
We'll talk about that in a moment, but I want to ask you what more you think that the Biden administration can do on a federal level to continue to protect those rights.
Well, we are working across the administration under the leadership of President Biden and Vice President Harris for the advocacy for and trying to protect equality for the LGBTQI+ community. I just have spoken with some of the members from the Department of Justice who have been weighing in from a legal perspective in a number of these regressive laws that have passed. I know the Department of Education is looking in terms of Title IX protections for LGBTQI+ students in schools, and we've been doing the same thing in terms of considering regulations to protect health equity for the community.
So one of the issues that has risen to the political stage has been gender-affirming care, particularly in youths, and that's something that you have been working on as well. And at least 18 states have passed laws or policies that restrict gender-affirming care for people under the age of legal majority. Do you think state legislatures and courts are the right places to regulate this question?
No, I really don't. This is really an issue for families. This is an issue for the parents of transgender and gender non-binary youth to be addressing with medical and psychological professionals. For example, much of the gender-affirming care in our country for youth is done by our expert children's hospitals. And I'm a pediatrician and adolescent medicine specialist. And so this is an issue between a young person and their family and their doctor and their other medical professionals. And I don't feel that it should be addressed in state legislatures and by governors.
Why has it been addressed by governors, by state legislatures? Why has it risen to this political level?
Well, there are many different articles that highlight that this is a specific strategy among think tanks in Washington for political and ideological purposes, is that the LGBTQI plus community had made so much progress in the past, particularly about marriage equality, is that they're trying to use the issue of these vulnerable youth and their families and their medical providers as wedge issues.
Do you think that there is space for questions about that type of care, gender-affirming care for youths, and how that should be dealt with on a federal level?
Well, I think that again, it really should be in the medical community, in the psychological community, about how to address that. We are trying to advocate for those youth and their families at the federal level. And again, there's work being done by the Justice Department and our work in terms of regulations. For example, we're trying to promulgate a regulation regarding the Affordable Care Act that says that when you cannot discriminate on the basis of sex, that includes sexual orientation and gender identity. So again, all of our focus at HHS is in terms of health equity.
You mentioned some of the attacks that the LGBTQI plus community is facing. What worries you the most about what you're seeing?
Well, what worries me is that we know that trans youth have a higher rate of mental health challenges, such as depression and anxiety, and an increased rate of suicidal ideation and even suicide attempts. Now, I want to be clear, there's nothing inherent with being transgender or being LGBTQ that would predispose a young person towards those mental health challenges. It is the bullying, it is the discrimination and the harassment that those youth and those families have that can predispose towards those mental health challenges. These laws and actions being taken by the states are exacerbating an already big challenge. And so I want to make it really clear, gender-affirming care is medical care. Gender-affirming care is mental health care. Gender-affirming care is literally suicide prevention care. It is a well-established part of medicine. It is done according to standards of care published by WPATH, the World Professional Association for Transgender Health, with new guidelines just in September of 2022. And it's being done by pediatricians and other pediatric experts throughout the country at children's hospitals.
Okay.
The governments of these states, the state action should not get in the way in between a young person and their family and their doctor. They should not be involved in that.
Final question for you, Admiral. You are the first open trans woman to be confirmed by the Senate, the highest ranking trans government official. How has your personal story informed your role?
Well, you know, I was so proud and honored to be the first. And so my goal is I don't want to be the last. And so what I want to do in my public health capacity is to really work for health equity for all communities and health equity, including the LGBTQI plus community.
Thank you so much for joining us on our show, Admiral. It's great to have you.
My pleasure. It was great to be here.
Well, we just heard Admiral Levine talk a little bit about health care in the trans community. At least 30 leading professional medical associations have issued statements supporting care for transgender people and youth. But Americans have mixed views on how to handle transition health care for transgender youth. According to a Pew Research Center poll last year, about 46% of U.S. adults would favor making it illegal for healthcare professionals to provide youth with gender transition care. When it comes to requiring healthcare insurance companies to cover transitional medical care, 44% of adults oppose doing that, while 27% of adults would favor covering this form of medical care. Well, we heard Admiral Levine mention WPATH, the World Professional Association for Transgender Health. For the medical perspective, I spoke to the president of WPATH, Dr. Marcy Bowers, a gynecologist and surgeon who specializes in gender affirmation surgeries. Dr. Bowers, great to have you on the program. What are the steps to providing gender-affirming care responsibly?
Well, Sumi, we all want what's best for our children, and that means whether they're in childhood or adolescence or adulthood, they're still our children. And when a child presents as gender diverse, I think the important thing is first of all, not to judge, and see where your child's at. So fortunately, most medical communities now have professionals who are knowledgeable in the area of gender diversity, and they should assess a child. So obviously, you want to rule out things that could be confounding, like mental health issues.
Right.
You also want to be responsible in making sure the rest of their lives are in order. But gender affirming care refers to meeting the individual where they are. So whether that's with pronouns, even just a simple matter of respect is really all that's required, and then letting the individual explore their feelings.
And Dr. Bowers, if I could jump in there, I want to ask you about one aspect of gender affirming care that certainly got a lot of coverage. There are a lot of questions about the use of puberty blockers with young children. What considerations do you think that parents or families should take before deciding for the child to take them?
Well, I think sometimes, and this may be a problem with the medical community too, is that sometimes parents feel under pressure that puberty is this cliff that their child might be going off. Let's say if they're presenting early enough to where the onset of puberty would be an issue. And the important thing is just to take time, is that this isn't a race, this isn't a rush. It doesn't necessarily mean waiting till adulthood, however. And bills that limit options for children during adolescence are going to harm, not help children and families.
So are you saying you do support the use of, Doctor, you do support the use of puberty blockers in specific cases?
Absolutely. Every case is individual, and that's another important component to the standards of care. WPATH, the World Professional Association of Transgender Health, has laid out guidelines by which an individual is evaluated. And mental health professionals and pediatric endocrinologists, we all follow these guidelines.
Okay.
So they're meant to be individualized. And again, in this gender affirming approach, we meet the child where they are. There's not a rush to doing blockers. There's not a rush to doing hormones, but puberty blockers offer a unique opportunity to delay puberty in a way that gender can be further explored. So they're not, and they're fully reversible.
Dr. Bowers, I want to ask you, of course, a personal question as well, because you were the first woman to hold a personal transgender history while performing a transgender surgery. How does that impact you before, during, and after such a procedure?
Well, thank you. I mean, I think it allows me to relate well and to hold also a credibility. I know what it was like to be a gender diverse child, an adolescent, and an adult. I mean, in my day, I had to wait until adulthood. But had I had the opportunities and the support, I'm quite sure I would have pursued things much earlier.
You mentioned some of the bans that we're seeing in some states for gender affirming care. What do you think the consequences are going to be for young people in those states?
Well, we're in a mental health crisis in this country anyway for adolescents, and these bills, make no mistake, they're not designed to protect children. These are cruel. This is legislative cruelty, and it's meant to deny these children access to care and basically punish them for expressing gender diverse feelings. So it's been a real devastating blow to the more than 50,000 children in states where these bans have already been enacted, and families are scrambling for what to do. These are families that want the best for their children. They're not trying to pull the child along. They're just trying to seek medical care for their child.
And Dr. Bowers, at the same time as we're seeing this movement in some states, there was a report released, as you'll know, by the Williams Institute last year, showing that the number of young people who identify as transgender has nearly doubled in recent years. Why do you think that is, that we're seeing that phenomenon?
Well, there's many that question that they somehow blame media or social circles or social media for extending this, but really, these are real numbers, and it's a fact that the world is diverse. Genitalia are diverse, and in their formation, and there are many of examples where genitalia actually are neither male nor female. And so with the diverse numbers of inputs that go into gender identity, that is the maleness and femaleness that one feels internally, of course there's going to be diversity. Right. And so at this point in history, we're realizing that look, there are a number of people who do feel differently than their assigned gender at birth. It's nothing to be scared of. There's still going to be male and female. Most people are going to be at the extremes of the binary, but this generation is showing us that, hey, there's a larger number than we thought that actually lies somewhere in between. And that fits with other measures in nature.
Dr. Bowers, really interesting conversation. Thanks so much for joining us.
Thank you for having me. Thank you for taking on this challenge.
Meanwhile, laws focusing on trans youth athletes have also made headlines across the U.S. Back in April, U.S. House Republicans voted to prohibit transgender student athletes from competing on sports teams consistent with their gender identity. The legislation would put violators at risk of losing taxpayer dollars. Supporters say it is necessary to ensure competitive fairness and support female athletes disadvantaged by having to compete against those whose gender identity does not match their sex assigned at birth. The legislation is not expected to be passed by the Democratic-controlled Senate, and it would not make it to President Biden's desk to sign into law. We've seen more than a dozen states ban transgender athletes from playing on girls' or women's sports teams. One of those states, Wyoming, had legislation enacted for that ban in March. Earlier, I spoke with one of the sponsors of that bill, Republican State Senator Wendy Schuler. Well, Senator Schuler, very good to have you on the program. Thanks for joining us this evening. Why was it important to you to ensure that transgender women and girls don't compete in female sports in high school?
Well, the real reason, honestly, is personal to me to some degree. I was one of those female athletes that was born pre-Title IX, had to sit on the sidelines and watch my brothers, cousins, all of the males in my life compete. And I didn't have that opportunity because there wasn't anything for the girls. So finally, when I was in college and Title IX was passed and I was able to compete, for the University of Wyoming in a number of sports, it was like a whole world opened up for me. And from that point on, after I graduated, I went into coaching as well as teaching, and I've coached both females and males. And I just felt like it was one of probably the greatest type of legislation that, as females, that we could have had passed in our country. It provided us a level playing field. It gave us the same opportunities as the men. It was amazing. So I have always been an advocate. I taught for many, many years and coached many years for the girls, and just felt like it was great for them to have their own lane and their own opportunities that were equal with the men. So that was really my personal reason for it.
And what is the specific challenge that you saw then that transgender women and girls would actually bring to that achievement as you described it?
Well, honestly, when I first had some constituents reach out to me about it, they felt like they'd gone also to another state, competed. We had started to see some examples in our own state of both at the middle school, high school level, both, where some of our biological females were being left off the podium and left back at the starting gate because we had some transgender athletes that were taking their place. And so that was the bottom line. They reached out to me.
So I want to ask you about what your governor has said. Your governor, Mark Gordon, who is a Republican, let the bill go into effect without signing it, as you know. And he wrote the following in a letter to the Wyoming Secretary of State. He said, "While I support and agree with the overall goal of fairness in competitive female sports, I'm concerned that the ban included in this legislation is overly draconian, is discriminatory without attention to individual circumstances or mitigating factors, and pays little attention to fundamental principles of equality." Are you worried about the impact of this legislation on transgender women and girls?
Well, I certainly disagree with our governor, and I have the greatest amount of respect for him. But I don't think it's draconian because actually, my bill, I have a section in there that if we are enjoined or if this lawsuit comes forth as a result of our bill, we have a Part B, I guess you'd call it, or fallback plan, which basically just says that we'll have a 5-member commission appointed by the Wyoming High School Activities Association that will then determine on an individual basis who can compete and who can't based on a variety of different issues.
This bill has drawn criticism, not only in Wyoming, but also beyond, as you know. How do you feel about that criticism?
Well, honestly, I think when you're a politician, just like when I was a coach, you kind of get thick skin. I felt like I was doing the best thing that I could for our biological girls, and I'll stand by that. I'll advocate for them from now until the end of time. And it's nothing against, I mean, I'm not transphobic. I certainly feel for the trans. I've never coached a trans athlete, but I would certainly treat them the same as I would any other athlete. I just think it's a fairness and equity issue. We have one athlete just one, I'll just give you one example of a trans athlete that will probably break the girls' state track record. That record in the high jump is actually held by a girl in my high school, and I feel very strongly about that. I don't think that's fair. He's quite a bit larger. I mean, there's all those biological things. It just takes the fairness and the equity away.
Senator, you spoke about Title IX a little bit earlier, and the Biden administration has proposed a rule change under Title IX that would prohibit schools from banning transgender athletes from competing on teams that are consistent with their gender identities. And just a reminder for our viewers, Title IX states the following: no person in the U.S. shall, on the basis of sex, be excluded from participation, be denied the benefits of, or be subjected to discrimination under any education program or activity receiving federal financial assistance. Are you worried that your legislation might be ruled unconstitutional?
No, I don't think so. I had a number of people that weighed in on it that helped me, basically put the bill together. And I looked at what other states are doing and what might work better for us. I think the fallback plan that I have takes care of the issues of people saying, well, it's just an all-out ban. There's nothing else for those trans athletes. There really is. We have already heard that it's going to be litigated. So we have this fallback plan, and I think that takes into account individual differences, because you may have an athlete that's in an individual sport. It may not have an unfair advantage, where you may have an athlete in a team sport where there's a safety issue and obviously a logical issue. And so there are some things in our bill for that.
And Senator, final question. What is your message to trans youth, trans athletes who might feel targeted by this legislation?
Well, honestly, I like I said, I feel for them. As a former educator, I always try to respect every student and treat them all the same. I know that there's got to be a place for them. I had people ask me this during the year when we were working on the bill. Where can they compete? Maybe we need to have their own lane. Maybe we need to have their own area for them to compete. And I'm not sure what the answer is, but I want them to feel respected and understand that, in my estimation anyway, this bill is strictly about fairness, having a level playing field for our biological girls. And there's got to be something for them. I'm just not sure what the answer is.
Okay, very interesting conversation. State Senator Wendy Schuler, great to have you on the program tonight.
Thank you for having me.
Now, earlier on Friday, the U.S. Supreme Court ruled that the constitutional right to free speech allows certain businesses to refuse to provide services for same-sex weddings. The court ruling in favor of a web designer who cited her Christian beliefs in challenging a Colorado anti-discrimination law. President Joe Biden, in the statement, said he was worried the decision could, quote, invite more discrimination against LGBTQ plus Americans. Now, earlier this month, President Biden hosted the largest Pride celebration in White House history. More than 1,500 guests picnicked on the White House South Lawn as Biden called for new measures to protect the civil rights and safety of LGBTQ plus Americans. He also urged Congress to pass the Equality Act that would amend the 1964 Civil Rights Act to include protections for sexual orientation and gender identity alongside race, religion, sex, and national origin. Biden made clear that his administration stands with the LGBTQ plus community.
I want to send a message to the entire community, especially to transgender children. You are loved. You are heard. You are understood. And you belong.
And the U.S. Vice President Kamala Harris made a surprise visit to the Stonewall Inn a day after New York's governor signed a bill to protect transgender youth. Harris's visit marked the first time by a sitting vice president to the iconic landmark. The Stonewall Inn was the site of the June 1969 riots, largely credited as a turning point in the modern gay rights movement. Harris also echoed the administration's support for the LGBTQ community, saying during the event, quote, "We are fighting for the ideals of our country. We believe in its promise of equality and freedom. We are not going to be deterred. We are not going to tire." Thank you for watching BBC News. I'm Sumi Somaskanda in Washington.